Hi there! Thank you for joining me on the last of our videos on Chapter 5. During this video we will briefly talk about the hair and nails as accessory organs of the integumentary system. We will also move towards giving some clinical relevance to what you have learned so far. So, I think that the last time that we spoke we had a look of this diagram. There is a lot of things going on, but we have also already covered a lot. So on this section we will look at the hair and some structures that are associated with it. I want to start though by clarifying one misconception that seems to be common in the media. Often I see these television and print ads where ladies in particular are told that with this and that product their hair will be much more alive. Of course, hair is not living tissue, it is dead. Just think about it. If hair was to be a living tissue, it would require a blood supply. Can you imagine what getting a haircut would look like if there were blood vessels there? Okay, but back to the topic. So, hair grows from the hair follicle at the root. And the shaft refers to the visible part above the skin layer. Do note that the hair itself is going to be very keratinized, much more than the epidermis that we saw earlier. And what gives the hair its color is dependent on what type of pigments are present, such as melanocytes that produce melanin. Here is something that I want to highlight. See this tiny muscle here, called Erector Pili muscle. As far as I know, it is actually the smallest muscle in the body. And it has an important job. Each hair has one attached to it. And the function of this muscle is simply to lift the hair up when needed. You had a video about that at the beginning of this module to learn more detail. I am an anatomist and I think it is so sad that every one of us remember all these big muscles around the body, but then this tiny yet so important and numerous muscle is often forgotten. So I'm on one-man mission to tell all about it to the world. So here I have a scanning electron microscope image of a hair structure as seen very close by. And this diagram shows a nice cross-section of the structures involved. Okay, the next structure that I want us to look at is the nails. These are even more heavily keratinized structures. I am sure that you can see how they are very hard. We see on this diagram that nail bed that is covered by the nail and the root from where the nail grows. It can be especially problematic if a fungus gets under the nail. So, what is the function of our nails? Why do we have nails? Well, they are all about covering and protecting these ends of fingers or nails, thus giving protection to the soft tissues underneath. And of course, allowing us to have fine grip, one of the advances of humans in an evolution. Why nails have no color? There is no melanin or other pigments in them. So that is all I have to say about the nails and hair for now. Now let's consider burns. We can have many different sources for the burns: heat, electricity, UV radiation, and chemical. Really, the biggest risk with the burns comes from the fact that we are now missing this important outer layer of our body that provides protection against so many things. So the two biggest issues would be getting dehydrated, as fluids can now escape the body, and infections being able to enter into the body without the skin barrier that normally protects us. So, because the extent of the area burned is important, we have something called the rule of nines to classify how much of one's body is covered by the burn. And in this approach, the body can be divided into 11 areas, each of which represents 9% of the body surface. But in addition to how large area is affected, it also matters that how badly the damage has penetrated the tissue layers. And I am going to have to warn you that next I have some quite graphic pictures, so please do not watch them if you are squeamish. Here we have what is known as first-degree burn. It is just red and swollen, probably painful, but as long as this is not a repeated exposure, it should heal fairly well and fast. When we get what is known as the second-degree burn, the skin is now very red and very painful, and we get blisters. Please remember that we should never pop these blisters, as this opens a direct route of infection. Now, the third-degree burn is characterized by a damage that extends through both epidermis and dermis, unlike with what we saw before. Now here comes one of the key criteria that should always be in your mind: the pain, or in particular, the lack of it. Whenever the patient has no sensation of pain, by a rule of thumb, you should be concerned. So here there would be no sensation of pain, and the tissues can no longer recover on their own. A skin graft is necessary. Finally, and I would like to warn you especially about this. In the fourth-degree burn, the damage is all the way through to the bone, and muscle and tendon and so on are fully damaged. Nothing is left. Here you will notice that the remaining parts are dry and leathery in appearance, and now amputation is really our only option, as there is nothing to be salvaged there anymore. Okay, let's talk a little about the skin cancer. Skin cancers are the most common form of cancers in humans, and most commonly due to too much exposure to UV radiation. In my opinion, especially the tanning beds that were big in 80s and 90s are a horrendous thing for what they cause in terms of skin cancer. When some of you go to the clinical practice, remember that the C word typically will result in your patient stopping to hear anything that you say afterwards. So try to find an alternative ways of communicating the message, or be prepared to it. So there are two broad groups of cancer that we need to be aware of. Benign cancers have not spread, whereas malignant cancers have. And this results in the much poorer prognosis for the later. I think that we should finish with some age-related changes in the integumentary system. So what happens is that when you are younger, your skin is typically thicker and more elastic, while as you age, the skin typically becomes thinner and loses at least some of this elasticity. Therefore, we say that the gravity doesn't work. On hair, we also see balding and graying. So that's it, our last video for this chapter. Please remember that independent study of your textbook is required for the higher grades, but now you should have an idea of the important basics. When you feel comfortable about your skills and knowledge, feel free to move on to the homework activities. This week there is something new there.